Hello everyone, welcome to our video about diabetes prevention. My classmates and I, uh, Brock and Chris, we've come together to create this video as part of our community health project. For the nursing class that we're taking together, we're all working on getting our bachelor's degrees in science of nursing at Brigham Young University, Idaho. We all live in different places, so we decided to create this video and post it on YouTube for everyone to learn about it, enjoy it. So at the end of this video, we ask if you'll make comments about your thoughts about diabetes and what you've learned. Let's get started.
So starting out here, we're going to be talking about some basic anatomy and some things we're going to be learning about. So blood sugar is the same as blood glucose. We're going to be talking about diabetes, insulin, prediabetes, insulin resistance, pancreas function, diabetes consequences, and prevention of diabetes. If we look at here at the diagram, that red thing there in the front is our liver. The liver stores nutrients for us and lets it go when we need it. And behind that, that pink thing there is the stomach that holds the food for us and then lets it go slowly into the small intestine. And behind that, the thing there that looks like tapioca pudding is our pancreas. The pancreas releases the insulin, which helps us balance the blood sugar. And so these organs here is the basics of how the body kind of juggles the sugar and the insulin and creates this balancing act to help us keep our sugar levels good, our energy levels good. The next slide here talks about diabetes in the United States. Unfortunately, our statistics for diabetes are getting worse and worse every year. According to the CDC Newsroom in 2017, 30.3 million Americans have diabetes, and that was as of 2015. That's 9.4% of the U.S. population, unfortunately. That's almost 1 out of every 10 person here in the United States has diabetes. Also, another piece of data is that 1/3 of the adults in the U.S. have prediabetes. Those are some really bad statistics, and unfortunately it seems like the trend is it's going to continue to get worse. So that's why we chose this topic and wanted to teach you guys about it. If you look here at the picture, that little machine there in the middle is a glucometer. Put a little drop, you prick your finger, put a little drop of blood on there, measures your blood sugar, and helps you see what your blood sugar is before meals, after meals, that kind of thing. So unfortunately we can't cover everything about diabetes, so we won't have time to talk about type 1 diabetes, gestational diabetes, which is a temporary diabetes that pregnant women get, and the management of diabetes as far as the insulin and the oral medications go. We're not saying these things aren't important, but we just don't have time to get to them. Diabetes type 2. So diabetes is characterized by difficulty of making or using insulin, and this results in the high blood glucose levels or the high blood sugar levels that have many negative side effects on the body. So if we look at the diagram here, this is our poor pancreas. He's sick, he's got the thermometer in his mouth, but he's holding on to that lollipop because he loves that sugar, and that's what's actually making him sick. So this is the problem in type 2 diabetes, is the pancreas is sick. Let's talk about insulin for a minute. Insulin is a hormone that's produced by our body. It's produced by the pancreas and it's released into the bloodstream. And the insulin then goes throughout our bloodstream and helps balance the blood sugar insulin levels. And the cells are able to take up this insulin and then use the sugars that they have. Now, if this balance doesn't work right for some reason, then we can get insulin resistance. And this happens for one reason or another. The cells are unable to balance these levels, and then our blood sugar rises, which can cause prediabetes, and then it rises further, can cause diabetes. And this is what we want to prevent. So we'll talk about that here further. Prediabetes is the elevated blood glucose levels from the insulin resistance, or the inability of the pancreas to to make enough insulin to keep up with our blood sugar levels. If you look at the diagram here on the left, the green part is the normal levels. FPG stands for fasting plasma glucose, and OGTT stands for oral glucose tolerance test. So these are the blood sugar levels at the certain part of the test, or a certain point of the test. So the yellow part then, when our blood sugars are elevated, is pre-diabetes. And we know from the statistics that we heard earlier that 1 in every 3 adult U.S. citizen has pre-diabetes. And then the red portion there signifies the elevated blood sugar levels that are indicative of diabetes. The consequences of diabetes are terrible. If you look here at the diagram, it shows some examples of that. With diabetes, you increase your risk of stroke, heart attack, and then also these other things here. When your blood sugars are high, it affects your blood flow. So you start getting things like peripheral vascular disease, peripheral artery disease, and it also affects other things like your vision. Your vision starts going blurry. Your kidney function starts getting worse and worse. And it also affects your nerves. So you get things like peripheral neuropathy, which is pain, numbness, tingling in the feet, legs, sometimes the hands. Now, because of all these things, you make yourself more at risk for diabetic foot ulcers. And with the foot ulcers, for example, if you step on a tack or something sharp, then that gives a way for bacteria to get into your foot. And then because the blood sugars are high and the blood flow is poor, the bacteria it's really easy for them to take hold and cause an infection in your foot. And so because of this, diabetics often need to have a toe amputated or a foot amputated if they're not taking care of themselves very well. So because of all these consequences, complications of diabetes, this is a good reason to make good efforts to prevent diabetes. And we'll go over that here next. So there are some risk factors that go along with diabetes. And the first ones here I want to talk about are non-modifiable risk factors that we can't do anything about. Genetics, age, gender, and race. Can't do anything about those, so we're not going to talk about those much further than that. Now, the modifiable risk factors are obesity, diet, inactivity. So we don't want to be like Garfield, who lays around all day and eats all day, doesn't exercise. That's the perfect recipe for getting diabetes. Now, they do say that an apple a day keeps the doctor away. If you look at this diagram here in the center, it's all fruits and vegetables. Food like this is good for us. Now, I know some of the foods have higher sugar content, so if you already have pre-diabetes or diabetes, you want to avoid some of those fruits that have the high sugar content. But vegetables are great, and eating a low-calorie diet will help you prevent diabetes, and my classmates are going to talk more about that, the exercise part of it and also the diet part of it.
As we are looking at diabetes, we're going to look at a couple different things. Later on, you'll talk about diet, but these few slides will be about physical activity and exercise. Physical activity can help keep diabetes from happening or delay its onset. It does this by improving blood glucose control, which is done when the glucose is taken up into the cells and burned with physical activity. So when the muscles contract, they're able to burn more fuel. We'll talk a little bit more about that in a few slides down. Various types of activity can have an impact on whether one gets diabetes or whether one already has it. It can help your glucose management. And those don't have to be intentional exercise in order to do that. So the muscle uses glucose for fuel. So when we look at physical activity, we look at how that glucose is burned. When we have physical activity, muscle activity, where they're contracting, especially with exercise, it's great for people with type 2 diabetes because your body releases glucose every once in a while from the stores that it has in the liver. When you exercise, you're burning more glucose faster than your body's releasing it from those liver stores. So it's helping keep your glucose in control. When muscle contracts, glucose uptake is not hindered by insulin resistance. So it doesn't need that insulin to take that sugar up into the cells when it contracts. Activity can improve insulin through the system for up to 72 hours. And aerobic and resistance exercise both improve insulin and glucose levels. When we talk about types of physical activity, the American Diabetes Association gave the following recommendations in the year 2015. For aerobic exercise, we should get 5 30-minute sessions a week at a moderate level. Aerobic exercise could be walking, jogging, anything that gets your heart pumping and you breathing harder. Resistance training, flexibility, and balance all look about 2 to 3 times per week. Resistance training, of course, is that which strengthens your muscles. So even carrying the groceries all the way up to weightlifting can be considered resistance training. Flexibility and balance can include things like stretching or certain balance exercises like heel-toe touches, or even exercises like yoga and Tai Chi. Exercise as a therapy. So exercise leads to weight loss, and weight loss has shown great changes in people with diabetes. Weight loss improves metabolic syndrome. It improves your metabolism. Weight loss improves insulin resistance, meaning that people who have more weight loss also show less resistance to insulin. Aerobic and resistance training lead to better weight loss. But of course, flexibility and balance training or exercises like yoga and Tai Chi also show weight loss benefits. Low levels of activity relate to obesity, which leads to type 2 diabetes and other chronic illnesses. Exercise reduces risk. Exercise has been shown to reduce the risk of developing type 2 diabetes, as well as many other chronic illnesses. Higher levels of physical activity reduce the chances of morbidity and mortality, or side effects and death from type 2 diabetes. Studies have found that being overweight is a greater risk for type 2 diabetes than a lack of physical activity. Physical activity itself decreases the risk of obtaining or making worse the diabetes, but the greatest benefit comes from the weight loss. Exercise and inflammation. We're talking about diabetes, so what does inflammation have to do with diabetes? Studies show that inflammation can be reduced by the exercise and physical activity that we're talking about. Inflammation damages the pancreatic B cells, which are important to diabetes or keeping it away because those pancreatic B cells are the cells that produce and store insulin. Inflammation leads to insulin resistance, leading to or worsening diabetes. As we exercise and reduce that inflammation, as our body composition improves, the inflammation that is decreased helps our bodies to have a better chance of not being insulin resistant. Insulin can come from various sources, so it's important to keep that inflammation down so that our insulin can function properly. When we talk about exercise and physical activity, obviously we've talked about inflammation, reducing risk as a therapy, things like that for diabetes. It has lots of important benefits. Exercise reduces the chance not only of developing chronic illnesses like diabetes, but also heart disease, stroke, and many others. Exercise improves our metabolism. It helps prevent weight gain. This in turn prevents the obesity and especially the visceral fat that leads to diabetes and other ailments. Hemoglobin A1C is basically a long-term measurement of glucose that shows whether someone is pre-diabetic, diabetic, etc. Of course, you have the daily finger stick method that you can use with the glucose machines, but the hemoglobin A1C is longer term. The American Heart Association reports that exercise improves hemoglobin A1C levels. Exercise helps minimize side effects of type 2 diabetes by controlling the glucose. Poor glycemic control increases chances of side effects and death, especially in older adults. So each 1% rise in A1C causes a jump in likelihood of an amputation or other bad side effects occurring. Conversely, each 1% drop in A1C drops the chance of diabetes-related death by 21%. Diabetes and exercise guidelines. Exercise does not have to be multiple hours of the day to see benefits. It could only be about a half hour or even 15 minutes if it's intense, but a half hour for moderate activity. Participate in both aerobic and resistance training for better results. Youth with type 2 diabetes should have an hour of physical activity daily or more that is moderate to high intensity activity. Increasing movement throughout the day in any way helps with glucose management. When we talk about prolonging exercise, we talk about trying to make it a habit. As we make this a habit, our long-term goals of a better hemoglobin A1C and better control over chronic illnesses like diabetes will come to fruition. Things to remember. Remember to talk to a healthcare provider before beginning any new exercise regimen. Your healthcare provider will know of your ailments as well as your ability to perform certain exercises, and they'll be able to help you come up with the best regimen for you, the best plan. Remember, any activity is better than none, but aerobic and strengthening or resistance exercises are best. Start where you are. If you can't meet the recommended 5 days a week and 30 minutes a day, try to do 5 days a week and cut it back to 10 or 15 minutes a day. Remember not to give up. It's always hard starting new things, but they can be very rewarding. The reward here is the avoidance of diabetes or other chronic illnesses.
Hi guys, this is Brock. I'm the third in the teaching trio. Today we're going over diabetes. Daniel's already talked to us about what diabetes is and how you can get it. Chris has also talked to us about the importance of exercise and the need to get out and get moving to help you manage that diabetes. I'm going to talk about the third and final part, which is managing your diabetes with diet. So to start off, I just want to say I understand being diagnosed with diabetes can be a hard and scary thing. You don't know what's going to happen. You don't know what's going on. You just hear about people losing limbs and all sorts of other scary things. But you need to understand one important thing. This is not the end. With good choices and some changes to your lifestyle and your diet, you can live a long, happy, and healthy life. One of the most early and important things that you need to change is your diet. The number one key to controlling diabetes is regulating what you put into your body, which is what you eat. So that's what we're going to go over today. And we're going to review just kind of what to eat, what not to eat, and how to stay healthy with diabetes and manage it. All right, I got this nifty little picture right here. It's kind of a diagram that shows how the body works with glucose and sugars and energies. I know Daniel already covered a little bit of this, but I'm just going to reiterate it. So the biggest challenge that a person with diabetes has is controlling blood glucose levels. Blood glucose levels are also commonly known as blood sugars. So you may hear that term often. They get interchanged often. Glucose is the energy used to power the cells in your body and make your body function correctly. We get glucose from any of the foods we eat. It's not just sugar. So when they say blood sugar or glucose, it's not just sugar that you eat, it's anything. So what happens is that food that you eat goes into your stomach and it gets broken down by all your stomach acids, and then it gets digested. And when it gets digested, it puts all that broken down energy, which is glucose, into your bloodstream. Now, in your bloodstream, there's usually this little stuff called insulin, which is little transporters. They grab a hold of your glucose and they run them inside of your cell. Now, people with diabetes run into the problem where they either don't have enough glucose or the cells have closed their doors and aren't accepting any more insulin in there. And so what happens is that glucose gets caught in your bloodstream, and it makes it really hard for your body to get the energy that it really needs. Having all that sugar stuck in your bloodstream can be a bad thing. It can lead to other health problems. So the goal is for a diabetic to know what the target levels of blood sugar are and what your blood sugar levels are. We usually check our blood sugar levels normally before meals. Daniel pointed out a little machine in one of his first or second slides that has a little tab on it. You poke your finger, you put your blood on that, and it'll tell you what your blood glucose level is, or your blood sugar level. So the importance levels are before you eat a meal, a diabetic person should sit between 80 and 130 for their blood glucose level. And then 1 hour after a meal, your level should not be over 180. This is the best way to stay healthy. The way you keep your sugars within range is controlling how much you eat and what you choose to eat. For a person with diabetes, the goal is to keep your blood glucose levels within a safe and healthy range. You don't want too much or too little glucose. Too little glucose can make you pass out or make you real dizzy and faint. Too much blood glucose is going to make your body want to get rid of it. And it also makes you prone to infections and loss of blood flow in different areas. And so it's very important to manage and control the perfect amount of blood sugar that you have. The keys to doing this are regulating what you eat, getting all the nutrients in your diet that you need, and planning and preparation, and just making all those good choices. Okay, portion control. The first and most important part of any good diet plan for a diabetic is determine how much and what to eat. So the amount of food that each type of food that a person eats is called a portion. If you look at my little picture, you can see that I've got there are little dotted lines that square off everything, and it kind of gives you a good example of what to eat. So controlling portions that you eat will help you get the good stuff. So the nutrients, including vitamins and minerals, and get rid of the bad stuff like fat and sugar and things that will raise your blood sugar too much. So having a balanced plate is a key to eating right. Eating right doesn't mean starving ourselves or skipping meals or eating weird foods that we can't pronounce. I mean, I've never been able to say it. Quinoa, I don't know. It means making changes to how much we eat and what it is that we eat. Many of us talk about being that meat and potato kind of person where you don't really like to eat vegetables and you just want to eat a lot of meat and potatoes. We fill our plates with a giant steak and then maybe a few starchy vegetables like potatoes. You can't keep doing that, to be honest. What you need to do, you can still eat your steak, you can still eat your potatoes, but you got to change up the portions a little bit. Mix around how much you eat. So this is the first part. If you look at the little paper, it says fill your plate up with vegetables, with a salad or some steamed vegetables. Eat those first before you dig into that steak. And you'll find that you don't eat as much of the steak because you're filling your stomach up with other nutrients, other things that are going to help you. So if you can just eat larger portions of healthier foods and smaller portions of the things that you really, the junk food and the fats and stuff like that, you'll do so much better. See, it's not a huge change in what you eat. It's just a big change in how much of each thing you decide to portion off. So changing the amount of good food you eat for the bad food is the first step in the right direction. And now for a couple of things we just shouldn't do as diabetics, or basically anybody, to be honest. Above everything else, please don't drink soda or sweet tea. There is so much sugar in those things. And also just avoid candy and sugary foods to begin with. Most of those have what we call empty calories. So they have no nutritious value whatsoever, and it's basically just raw sugar that you get that will just spike your blood sugar, causing all sorts of issues. And it may offer, the only thing that they have to offer is a little bit of a sweet taste now and a guilty feeling afterwards. So just try your hardest to avoid these types of things. So instead of drinking sodas and sweet teas and other things with high sugars, try drinking water. I know it's a really weird concept to some people, but water has no calories and you can drink as much as you want. It can fill you up. It'll help you eat less food because it'll take space up if you drink a glass of water before you eat your meal. It's refreshing to drink a nice cold glass of water every once in a while. Plus, in the long run, you will be healthier and happier making a habit of drinking water instead of anything else. Water is just a good diet choice. Okay. So now we've already talked about how much of something to eat and certain things that we should totally and always avoid. Now let's talk about what we should eat. This is a little bit more tricky. There are so many choices, so many good choices, so many bad choices, and there's a ton of gray areas. So this can get a little bit difficult. This is where most diabetics get hung up. They just don't know what the right thing for them to eat is. So what I'm planning on doing is giving you a little bit of counsel and some resources on what would be best for you and how you can get that information. So the reason why it's so tricky to determine what it is that is good for us to eat, what's going to be the healthiest for us, is because everyone's different. This makes things really hard in many different ways. There are different foods in different cultures. Most cultures revolve around food. And so me telling you exactly the meal plan you should eat is not the right thing. Instead, I'm going to give you some guidelines on what is good and what's not good, what should be avoided, what shouldn't be avoided. Everybody has different lifestyles. Everyone has different tastes. I can't tell you what to eat because what I like to eat may be different than what you like to eat. So let me just give you some ideas of how to eat and best resources that you can get that will help you maintain your best diet. So balancing your diet is key to having a good diet. There are three main parts to any good diet: proteins, vitamins and minerals, and carbohydrates. Now, some foods can have lots of proteins, but no carbohydrates, and some foods can have too many vitamins and minerals and not enough of the other two. It's very important to balance everything out to make sure that you get enough of everything. We're told to avoid too many meats, like don't make meat make your biggest portion, as we talked about earlier. You can limit your portion of meat and raise your amount of vegetables you eat. That's the best way for a diabetic. Lowering carbohydrate intake is actually a really good thing for a diabetic too. Too many carbohydrates makes that blood sugar just go up, and it's just not it's not healthy for you. Oh, so when looking for the best diet, it's important that we try to find foods with the most nutritious value. That means the best nutrients and for the least amount of extra calories. Nutrients include carbohydrates, proteins, and vitamins and minerals. All these things make our bodies work and function properly. It is important to balance these categories out. If someone gets too much protein, say eating a giant steak, and not enough vitamins and minerals, maybe avoiding vegetables and fruits, then their body's just not going to function right, feel right, and you're not going to process your sugars right. The same goes for each category. So it's important that we balance everything out. Foods that a diabetic person should avoid include foods with empty carbohydrates, which means no nutritious value, but just carbohydrates alone. Those are mainly found in fats and high sugar content foods. These foods add too many calories to your diet without giving you any benefits whatsoever. Fats include fatty meats, such as fat beef with lots of fat in it, a lot of pork, and fried foods is always the enemy. All these foods strain the body and can make your blood glucose levels skyrocket when you eat them. So as I said before, I'm not going to sit here and tell you the exact type of foods you should eat, but what I am going to do is give you a couple resources. So in 1980, Dr. Thomas Wolver and Dr. David Jenkins created an in-depth index that helps people determine how fast different foods are converted into sugars in your blood. This guideline is called a glycemic index. And if you look at the chart right here, here's just a small look at what they do. Now, the higher the number, the faster they turn into sugar in your bloodstream. Now, the reason why understanding this is important is because knowing how fast something's going to turn into sugar in your blood will help you regulate your blood sugar better. So what your goal is to eat low glycemic index foods. That would mean cutting out a lot of the sugars and high starches that can, right when you eat it, make your blood sugar skyrocket. If you can control your diet through the glycemic index, it will help you maintain your blood sugars better. Maintaining those blood sugars, like I said, will help you avoid all the nasty side effects that diabetes can bring, such as infections and losing limbs and losing blood flow to areas and heart disease and all sorts of kind of things. So it's very important, these different resources. Now, I've also put this little picture up here with this little blood drop on it. It's an app that you can find. You can go into your Apple Store or Google Play, whatever you have, and you can download it. And also the website up above is a nice, the University of Sydney put together. You just type in what food it is and it'll bring up that glycemic index. The little app is great because you just throw it right on your phone and you'll have something to look up. You just click on it, put in what food you're looking for, and it'll tell you your index. So if you look, you want to always be below 70 on the glycemic index. This doesn't mean that I can go out and eat, because pizza's 33 if you look at the first one on the snacks. I can go out and eat 10 slices of pizza because it's just not going to do the thing. You still have to regulate your portions, but It's just telling you, don't go and eat a jelly bean, which is 80 on the glycemic index. If you're going to eat something like pizza because it's a little bit lower. One of the biggest key to success in any endeavor you do in your life is to plan ahead. So planning in a diabetic's life is more about knowing what you need to eat beforehand. Don't randomly end up at the grocery store hungry and ready to eat everything in sight and just pulling things off the shelves. The best ideas would be to plan ahead. Make a meal plan for your week, look it all up on your glycemic index, and then go to the store and buy what you need. Also, when you get to the store, avoid buying pre-made foods. They always have more calories. They always have less nutritious value than a home-cooked meal. Yes, it's a little bit more work, but in the end, it is worth it because you will be healthier, you'll be stronger, and you'll be happier. If you look over here to the left, I have one of those little things that everyone sees, but nobody ever really pays attention to. It's our nutrition facts guideline that almost every food container has. If you kind of look at the different categories, you can get an idea. It'll tell you the proteins that you have. It'll tell you the carbohydrates that you have, how much fat is in everything. And you can use that as a guideline. Did you know that you could look almost every product up online that has one of these? So, I mean, you can look a banana up online and it'll tell you the nutritious facts of it. So it's not something unattainable. We have the internet and you can jump on there and do all these things. The second part to planning is if you're gonna, you don't, like I said, you don't have to change your whole life. If you're gonna go out and eat, and if say the family wants to go out to a restaurant, you can look up ahead, look at the menu, look at the facts, the nutrition facts on the diet, on the food plan of the menu. You can ask if they have healthy options before you show up, and you can determine where you're going to go and what you're going to eat before you get there. That way you can still live your same lifestyle, just changing it up a little bit. It's not a huge, difficult task. So in the end, the main things that we recommend for your diet is to learn portion control. Like I said, get more of the good stuff, avoid the bad stuff. Make sure you're eating lots of vegetables or adding vegetables to your diet and eating smaller portions of meat and dairy and things that are going to be a little more fatty and unhealthy for you. Next, just avoid those foods with lots of sugars, fats, and empty carbohydrates. Try to pick the good stuff. If you need a snack, find something that's healthy. Balance out your carbohydrates, your proteins, and your vitamins and your minerals. Like I said before, know what you're eating, refer to your glycemic index, and plan your meals and snacks ahead of time. Follow your blood sugar well. Get yourself a glucometer and check your blood sugars before every meal. As we talked about before, it is a difficult disease. It is something you do end up having lifelong, but it's not something that has to change your life dramatically. You just have to make a few lifestyle changes. It's not the end. You don't have to be one of those diabetics that ends up getting infected, losing a leg or foot, or having any other complications. There are many type 2 diabetics that don't even need to use insulin or any type of medication to regulate because they eat healthy, they live healthy lifestyles. Understanding your disease is the most important way to fight it. And so with this, we leave you. Thank you so much for paying attention to this, and please, as Daniel said before, leave a comment for us in the comment section. We'll answer any questions you guys have. Good luck to you, and again, thanks for listening.